We got to talk about Buffalo safety Damar Hamlin. He had his heartbeat restored on the field after suffering a cardiac arrest during the team's game last night against the Bengals. He's currently still in critical condition at a Cincinnati hospital. The Bills said in a statement early this morning that not really a whole lot of change. We're getting varying reports, and I'm hesitant to throw every report out there as I get it because I haven't had a chance to confirm one way or the other. I don't believe the NFL has ever suspended a game like this because of an injury. And, honestly, I think they probably did the right thing based on what I saw with other team members on both sides of the field. It was midway through the opening quarter, Monday night, between two NFL powers, and it led the league to postpone the game about 90 minutes after kickoff. And finally, they said, okay, that's enough. And they just suspended the game. Not sure if and when it will be replayed. But I thought we'd get some information from somebody that deals with this every day. When I first saw what was happening, all kinds of thoughts started going through my head. Most of you know, a year and a half ago now, I guess, I had a quadruple bypass. And, I had Dr. Singh and Dr. Weiss tell me exactly how this all works, where they pull your heart out of your chest and they can either keep it going on its own or through a machine. And, it's about a 4-hour surgery, if not more. And I thought to myself, that, for me, that's one thing. This is a 24-year-old kid. But I also know, based on what I've learned, if you hit somebody just the right way, at the right angle, with the right pressure, that what they call blunt force trauma, you knock the heart out of rhythm. And I'm not exactly sure if that's what happened or not. But with me is Dr. Fahmi Farah, medical expert and cardiologist. Dr. Farah, thanks for being with me. I appreciate it.
Hey, thanks so much for having me.
Pretty scary sight last night on the football field. Based on what you've heard, how would you, in your perspective, how would you sum up what you think happened? Of course, there's still a lot of unanswered questions.
Certainly. It could be a number of things. When I saw the event, a number of things ran through my head. He's obviously a very young, fit athlete, 24 years old. But there are certain things that are pretty classic that could have been the cause behind it. One of them, of course, is commodio cordis that you've heard about in the news by now. It's a sudden, blunt impact on the heart that can cause the heart to go into arrhythmia and cause cardiac arrest and collapse, kind of like what we saw. But there are certain other things, too, like, the blunt trauma that he had, like that big blow. There's something called tamponade, cardiac tamponade, that can lead to arrhythmia and cause collapse and cardiac arrest as well. So what is tamponade? Tamponade is basically in our heart. It sits inside a sac. There's a sac around the heart. In a normal heart, there's no space between the sac and the heart. But when we get a blunt force in our chest, kind of like in this case, sometimes we see those in motor vehicle accidents as well. What happens is blood leaks out into that space. And if the volume of blood that leaks out is large enough, it can cause the heart to stop functioning and people can go into cardiac arrest. Some of the other common things, not so common but well-known things, are there's something called hypertrophic cardiomyopathy. This is a well-known condition, and the scenario is pretty classic presentation. So it could be that, too. This is a genetic disorder of the heart. People are born with it. And in this, those who have it, their heart is enlarged. Their muscles are the heart muscle is increased in thickness, and they live a fairly normal life until, like one day while they're playing sports, typically on the field, is when it's diagnosed they'll have a sudden cardiac arrest. They'll just collapse while playing. We see this very classically. So in these folks, when they are playing or engaged in strenuous activity, they could have arrhythmia like ventricular tachycardia. What that is basically the heart rhythm gets thrown off and the heart starts going erratically very fast. And that can cause the person to collapse and have a cardiac arrest. So any of these could have been involved. It could have been any one of these as the factor. One of the other things that came to my mind is, pandemic itself, COVID-19. So we know from early on that we have had several incidences where professional athletes had cardiac arrest who had been infected with COVID. And although they were not symptomatic when they had COVID, but the COVID itself caused damage to their heart. There's a condition called myocarditis.
Right.
And when they went to play with that strenuous activity, they went into ventricular tachycardia, again, the same kind of arrhythmia, and had cardiac arrest. So that could be at play here as well. So it could be a number of things.
Finally, I suppose, we're told that his heart stopped on the field. He was given CPR, and evidently they got his heart started again after several minutes. But those several minutes will determine whether he has any brain damage, correct?
That is correct, yes. So statistically speaking, the prognosis for out-of-hospital cardiac arrest is not very good. The survival rate for out-of-hospital cardiac arrest is very, very low. But that being said, one thing that does go in his favor is how quickly they attended to him and how quickly they started CPR. That is something that's very, very good here because that means his circulation was, the chance of brain injury should be less in this case because he received CPR early on. But the duration was actually quite long.
Right.
The fact that he had to receive CPR for almost 10 minutes, that's quite long. So only time will tell, but you're absolutely correct. One of the things, there are two major things we worry about whenever something like this happens. One is the survival rate itself. And, he's in very critical condition right now. I do hope that he pulls through. And if he does survive this, the second question is the long-term damage. One of them is, of course, neurological damage. Only time will tell.
Yeah, I know my own cardiologist. He has me come in every once in a while, and I guess the only way I can explain it is it's like an ultrasound of the heart that you go in and get. And I guess they check to see if it's changing shape or just what it's doing, and so far so good. But man, we really pray and hope this guy makes it through, and certainly his age and his condition is working in his favor. But the thing you have to worry about is the length of time. Even though he was receiving CPR, the length of time, I think it was 9 or 10 minutes.
Yes, that's actually quite long. But, it's still less than 30 minutes, so I'm still very optimistic.
Well, listen, I appreciate your expertise, Dr. Fahmi Farah, medical expert and cardiologist based here in Texas. I appreciate your thoughts.